It's a continuation of the previous video regarding the spotters or afternoon viva sample questions. There is one question yesterday. They asked whether the follow-up question will be there in all the spotters. No, if only the spotters are in the afternoon, in-person examiner is there, he might ask you the question. In many DNB centers where they conduct the exam in the same format where the display of the slides have shown, you have to answer those in a A4 sheet and give the paper to them. Only whatever the question mentioned are there, that is to be answered. The format of the exam, if the examiner is going to show you the spotter and ask, probably the follow-up questions might be there. So now we will see a set of 10 questions. First is ECG. Question: what is the finding, diagnosis, and how to manage this case? Very simple one for a final year MD student. A clue adenosine is being used in the treatment. So finding, probably they might ask you to read the ECG. In any ECG, you should know how to read the ECG. What is the rate, rhythm, interval, how to calculate, how to set all T waves and all those things. You should be aware. Probably those questions might be asked. Second spotter, again the ECG. Describe the finding and what is the diagnosis. Look at the findings over here, 2, 3 AVF. Look at the finding over these leads. The follow-up questions might be how to locate the blood vessel which is involved in MI based on the ECG finding. Location of the MI, lateral wall, inferior wall, posterior wall, anterior wall. What are the ECG finding? A few questions might be related to how to load the patient. What is the time interval, door to needle time, door to balloon time? Those kind of questions you might expect with respect to this ECG. Again, a simple diagnosis: 2-3 AVF, ST elevation, and some depression in the corresponding opposite leads. I hope you got the diagnosis. 10 more seconds, we will shift to the next slide. Chest X-ray. Question is: describe the finding. What are the possible causes of this finding? So similarly, they might ask you to read the X-ray regarding penetration, positioning. The question might be there. Here, focus over this area. So what could be the DDs? Something related to that particular lobar type of consolidation where you will get opacity. Questions might be related to pulmonary embolism. I hope you got the answer for this also. Spotter number 4, this time chest CT. The question is: what are the finding? What is the diagnosis? And the outline of the management. To look at the cavities, they might ask you to read the entire CT film. If it is in the afternoon spotter, they might ask you the difference between contrast CT and a non-contrast CT, how to pick it up, what is the amount of contrast being used, and what are the specific finding in fungal pneumonia, viral pneumonia, bacterial pneumonia, what could be the fancy signs you will get in pulmonary embolism. Those kind of questions might be there. Here there are multiple cavities. They might ask you DD for thick walled cavity, thin walled cavities. These might be the follow-up question. Quarter number 5, one peripheral smear. Describe the finding. What are the possible causes of these finding? So in the peripheral smear, you should be able to identify a normal RBC and the abnormal one. Here you are able to see the RBCs and you can try to make the DD and the finding. Since they are asking not the specific diagnosis, they are asking the possible causes. So with this, I hope you can make the diagnosis. The colors are not as normal. The size is also as not normal. The question might be Menzer index might be asked. What are the common etiology of the specific condition can be asked. Why B12 deficiency is common, why iron deficiency is common. What are in India, the most common is nutritional or iron deficiency. What are the other things, other causes of this iron deficiency? Apart from that, transport mechanism in the stomach can be asked. What is the relationship between vitamin C and iron can be asked. These are some of the follow-up questions. And in some institute, mostly very rare, they will give you the slide along with the microscope. Usually they will come with the slide only, like this kind of PPT. If they come with the microscope, probably the institute might have already informed you that the microscope is there or not. You should know how to adjust the microscope and see under which power and all. At least basic knowledge should be there. Probably MD student might be informed with respect to the exam pattern. A student who is attending DNB exam to your institute where he is not aware, probably you might be prepared for this or how to handle the microscope, or speak with the seniors over that institute whether the microscope is being given or PPT kind of slides being given for the histopathological examination of this peripheral smear type. Next quarter, very easy one, exophthalmos. What are the abnormal finding? What is the mostly likely diagnosis? So this is a simple spotter you can easily make out. I might ask what is the pathophysiology behind this eye being popping out? What are the other DDs? What are the other manifestation in cases of thyroid disorder? This might be the follow-up question. Next, drugs. Flumazenil mechanism of action, easy one. What is the drug used for and the mechanism of action? Dose, most likely they won't ask. Again, one more drug, amiodarone. What are the indication for using this drug? What is the dose? Some of the adverse effect. Amiodarone is an important theory question also. So you should be aware of this adverse effect, indication, when to do, how to give and all. As a medicine MD, they might be checking you by asking how to make the infusion in real time. Like how much to be taken, how much to be put inside what, whether ringer lactate to be used or oral to be used, or how you will dilute it, or how many hours you are going to give it. These are the questions you might ask. Since you did it in your final year or during your MD residency, this question will be an easy go for a student who managed in the ward regarding arrhythmias and all. What is this instrument? What are its uses? It's a bone marrow biopsy needle. You can do the aspiration also with that. The question, follow-up question might be, what are the site where bone marrow aspiration or biopsy can be done? What is dry tap? What is the complication of this procedure? And what is the difference between this needle and the another one with the gourd? What is the price of this needle? If the examiner is so impressed, if you are able to answer the initial part of the question, probably they might ask you the price of this needle, because the patient have to bring it, then only in the ward you can do it. Many institute MD medicine residents are doing, in some institute pathologists are doing, and in very bigger institute where hematology department exists, the patient usually get referred to hematology department. Last spotter related to imaging. So NCCT head, describe the finding, name some causes of this condition. Finding, I hope you made out. Here they might be asking the internal capsule anatomical supply, anatomical location, how to differentiate between bleed and infarct in CT. Probably that might be UG level kind of question. They might ask you what are the most common site of bleed, symptoms of cerebellar bleed, how to differentiate extradural, subdural hematoma, what are the findings, and why you are saying the location is there, what is the nearby anatomical structure, what are the complication, this kind of follow-up question might be there. So this completes the second set of spotters. So we have seen 10 questions in the previous video, now another 10 questions.